Hello, I'm Dr. Sri Banerjee, epidemiologist, biostatistician, faculty member, and it is with great honor that I'm presenting this for the American Public Health Association 2023 in Atlanta, Georgia. And I'm presenting on behalf of Rafael Gonzalez Lagos, who put this together, and I'll be presenting. So the topic of this talk is effects of food insecurity on premature death in the U.S. Now, a little bit about food insecurity in the United States. Before the pandemic, the food insecurity rates were going down. This was the first year, according to the reports, that food insecurity was up higher than what was seen in the pre-pandemic levels. So this is on the rise and quite alarming, honestly. And this is the reason why I'm presenting on this. So the way this talk is organized is that we'll be evaluating the geospatial distribution and effects of food insecurity on premature death in the U.S. context of social determinants of health and related political precursors. So I know we know that we talk about social determinants of health not in conjunction with political features. However, as we know, the political environment leads to some of the policies that are made with the domains, with the social determinants of health. So the next segment that I'm going to be going over is food insecurity in the U.S., food insecurity's adverse effects on health and premature death. And these will be more shown visually, and then for food insecurity's disproportionate burden on lower income demographics and other vulnerable populations. The next section will be understanding social determinants of health and related effects as modifiable risk factors for human health dynamics and related outcomes, human development and related economic growth, and then catalyze a sustainable approach to positive social change so that we can make sure that the changes that are made can last for generations to come. And this will be through human development with economic growth. So here's the abstract. Some of the highlights of this abstract is that we went over and provided some of the p-values and some of the factors that are in here. And this was mostly from the global model. However, as we include geographically weighted regression, I'm going to show you more of what's happening at the local level. So here is food insecurity and food environment index. Food insecurity is, rather than the lack of access, food insecurity is how much hunger that you're experiencing. That's how I like to say it. Hunger people understand more than food insecurity. So the highest food insecurity individuals would have more hunger. Now, food environment index is a bit more concrete in terms of combining various measures such as access and distance from food places, healthy food places, and then also looking at access. So the social determinants of health entail all non-medical factors affecting health dynamics and related outcomes. And what is important is that this represents where we are born, grow, work, live, and age alongside natural and built environment. And the social determinants of health framework allows for the evaluation of the association between premature death and social determinants of health in the U.S. context of chronic diseases from its 5 domains: education access and quality, healthcare access and quality, neighborhood and built environment, social and community context, and economic stability. So it is crucial to understand social determinants of health in terms of modifiable risk factors, human health dynamics and related outcomes, human development, and related economic growth. So what all this means is that if you look at each of the domains, they lead to a lot of the premature and chronic diseases. Now, if we think of social determinants of health, this is addressing more of the upstream factors that are available and modifiable. So the idea is that earlier the age we understand what is connected to health, the earlier we can kind of curb the risk factors, and this will prevent mortality and severe morbidity. So another thing to understand is that this is usually this is the Dahlgren Whitehead model, and usually you have kind of the immediate individuals, and then as it goes out, you have ecological model, and then kind of at the society level, this is what's happening. So the Food and Environment Index, let me go over this again. This is constant access to healthy foods. So we're looking at healthy foods more than any food in a specified socio-demographic and related geographic area. So in that area, if there's 0, then this reflects worst outcome, and 10 is the best outcome. What is important to note is that Food and Environment Index is inversely related to food insecurity. So higher the food insecurity, the lower you have Food Environment Index, and vice versa. Some of the other things, the reason the Food Environment Index is a bit more detailed than food insecurity is that this is a composite of access to foods and access to healthy foods, and looking at the area. So if you're thinking about the Appalachia area and the southern region, one of the things that happens in Appalachia is that there's a lot of poverty there, and occupationally they're exposed to more of the mine industry and everything, and a lot of this is contributory to some of the premature death that we see, and the smoking rates that have a higher preponderance there, and it amplifies the effect of, as we know about malignant mesothelioma, and how there's a compound effect between occupation and smoking. So this is only one of many reasons, and I want us to brainstorm about this, about what are some of the reasons. And so this is premature death prevalence. As you can see in the Northeast, there's not too much of this. Then when we get to Maine, there's more poverty here. So there's ways at the global level. This is at the level of the United States, and then if we go in and look at state by state, then you look at Mississippi and Alabama, and there's the highest rates of premature death, along with Texas and New Mexico. And I would suspect these are some of the reservations where there's a lot of poverty and much lower, much earlier death. Now we're looking at some of the chronic diseases that takes place. They're either exacerbated or promoted by protracted exposure to social determinants of health and related health dynamics. Chronic diseases, how much does the federal government spend? About $4.1 trillion. So if you look at the prevalence of diabetes in this area, again, in the southern region and the Appalachia region, there's and the same regions you see type 2 diabetes. Then you look at some of the moderators and mediators. There's excess poverty, of course, and then related comorbidities, age, gender, ethnicity, and hypertension. And then exposure to social determinants of health, food insecurity, food environment index, chronic disease, and what I would add in here is air pollution as well. And that leads to that actually is related to disease, directly related to premature death, due to the fact that there's more disease that is there as a result of global warming, and then a lot of the forests and things like that are transitioning into ones that are not sufficient carbon sink, and so that is harmful for human health. Now we're going to take a look at premature death and food insecurity, and it is in the southern region that all of these are taking place in terms of type 2 diabetes mellitus, heart failure, high blood pressure. All of these kind of consistently are in the same region here. There are some variations, though, as we go westward in terms of Texas, where there's even in eastern Texas, there's a premature death. There's premature death and food insecurity. And a lot of the southern states are have this pattern. So next, we're taking a look at premature death and air pollution. This is really interesting because, again, these are areas where a lot of the trees have been replaced by succession trees that are not sufficient carbon sinks. However, they needed to be replaced to riparian forests, and that would explain some of the premature death from air pollution that is experienced in the Appalachia region. And Food Environment Index with air pollution, some of the regions are more highlighted than others, some of these southern regions. And that could be due to the fact that it's less accessible to go to the grocery stores there. So taking a look at this hotspot analysis, you can see that food insecurity, premature death, and type 2 diabetes mellitus kind of have clustering around the same areas. Now, premature death is less around the Atlanta region. However, as you go up north into South Carolina and Tennessee, there's much more premature death rather than food insecurity. That's interesting, actually, because this premature death covers a lot more in the Appalachian region than food insecurity. So this would say that even though there's not too much food insecurity, so food insecurity is not directly related to premature death as much as type 2 diabetes. So let's take a look at the premature death model. So all of these predictor variables, food insecurity, diabetes prevalence, all of these were first looked at the global model. And in the global model, we saw the beta estimates there. And so we were looking at multicollinearity here and found that there was none. So that was the assumption that was made here. And then if we look at the strength of the model, if you look at the geographically weighted regression, then the strength is 0.68. Now, there's not too much variation for the multi-scale geographically weighted regression results. However, it's 0.71. What is multi-scale geographically weighted regression? Well, the bandwidths around each of the areas are actually varying depending on various things. So, when you have when you have the standard deviation is much less here in terms of this is where the R squared comes from. So here we're looking at the z-score and the surrounding areas being more clustered than the others. And And so if you're looking at GWR, there's some areas that are many areas that are yellow, and then there's interspersed orange everywhere. And that's interesting because the yellow and the orange are more clustered. And then the red and orange have actually more stronger relationship than the clear version, and then green has even less of a strong relationship. According to MGWR, seems the same. However, there's a slight increase in the strength of the model, as you can see, 0.68 to 0.71. So in conclusion, the social determinants of health framework allows for the evaluation of geospatial and temporal varying relationships. Social determinants of health adversely exacerbate and promote the adverse effects of food insecurity on premature death, especially in the U.S. context of chronic disease. Social determinants of health are modifiable risk factors for human health dynamics outcomes, human development, and related health outcomes, related income outcomes. And then food insecurity disproportionately burdens the health and finances of lower income demographics, related economic minorities, and other vulnerable populations. Geospatial analysis via GWR and MGWR renders greater statistical power than OLS fitted multiple linear regression. And so a culturally sensitive and integral approach to public health from a community-based participatory research perspective is required to foment and catalyze a sustainable approach to positive social change through human development with economic growth. So it's important to note that sustainable change is especially important, and social determinants of health adversely, if there's poor social determinants of health, or a lot of social determinants of poor health, then premature death increases. So food insecurity and premature death are promoted by adverse social determinants of health. The social determinants of health framework allows for the evaluation of geospatial temporal varying relationships. So the social determinants of health are kind of the crux of that you can use to frame some of the ideas in terms of geospatial studies. Thank you for listening. Here are my references.